Thank you all so much for coming to today's workshop. Maybe you came to the last workshop we did, as was said in the introduction. That was sort of a foundational workshop to talk about health data privacy. And we talked a little bit about how libraries can support our communities through the health journey in a digital landscape. And today we're going to dive a little bit deeper into that and talk about where libraries come in, what other considerations we should make when we think about health data privacy. I'm going to do a little bit of reviewing, but a lot of this is going to tie in nicely and maybe expand upon last webinar. But you didn't miss anything that you'll need to know for this one. So feel free to go back and watch that when you get a chance. But this is hopefully going to be new and exciting in a different way. So today, our objectives are going to be, by the end of this webinar, I'd like everyone to be able to identify some vulnerable moments in our digital health journey. I'd like everyone to learn a little bit about teaching privacy to staff and to the public. And then I'd also like us to all understand the ways that library staff can support our communities when they seek digital health information. And then finally, gaining tools and techniques to advocate for privacy in our libraries. This is our agenda. I'm going to give you one more small introduction to Library Freedom Project because they're a great resource, just a really good community to know about. We'll talk about when our health data is vulnerable, and then we'll talk about where libraries come in, and then hopefully we'll have some time for Q&A. I have a couple of activities for us, so feel free to engage in the chat. Again, my name's Tess Wilson. I am an advocate with Library Freedom Project. That's my information. Feel free to reach out. I am always happy to talk about privacy, to talk to your libraries or anything else. Just happy to chat, lead workshops, and answer any questions that I can, or do some research about privacy with you all. Library Freedom Project is a group that teaches librarians about surveillance issues, privacy rights, and digital tools to support the fight against these issues. The first Library Freedom Institute cohort was held in 2018, and that was when about a dozen library workers got together to learn how to address privacy in their own communities and become better privacy advocates. And since then, it's turned into a community of practice that supports not just those cohorts, but smaller, more accessible crash courses, as well as a growing community of practice and continuous advocacy. So what this looks like is presenting at conferences, organizing protests, facilitating learning opportunities all over the country, and contributing to publications and other professional platforms. So what you are hearing today is one of our workshops. We really like to present, like I said, to library councils, individual libraries, any way we can talk about this information with folks who are curious about it is kind of our bread and butter. And we like to say it's really hard to become a true privacy expert because our digital world is constantly changing and there are new considerations all the time, but this group, this community of practice really helps us stay informed. And I just wanted to take a moment to plug the Library Freedom Project crash courses. I talked a little bit about these last time, but these are free privacy-focused 2-month trainings for librarians to learn how to become privacy champions in their spaces. The most recent one focused on privacy in library infrastructure, so it included topics like creating good privacy and data governance policies, conducting privacy audits, working with library IT, understanding vendor agreements from a privacy perspective, and a whole lot more. So these do cover some technical stuff, but they're intended for library workers without a formal technical background or role. So you can find out more at that link or just email me. I highly recommend them. They're really nice ways to engage, and you can put in as much effort as you'd like, as feels right to you. So I wanted to do a quick review of what exactly health data is and when it might be vulnerable. First, I wanted to show you something we talk about a lot in Library Freedom Project, and that's the privacy risk versus personal reward equation. Almost all of us use smartphones, tools, and apps to connect with people and make our lives easier. And that includes health-related devices and apps. Some of the same features in apps that enhance the convenience for some people can also put other people at risk. For example, a person who's experiencing intimate partner violence or an undocumented immigrant might have a very different profile, a risk profile, than someone else who might be using that same tool or app. So one great way to think about this is to create a pros and cons list or note down the risks and rewards for certain services or tools. So sometimes when we teach privacy workshops, we ask folks to pick one side to argue. We pair people up and ask them to pick one side to argue, whether this is a good tool or a risky tool. And then we give them 5 minutes or so to talk about whether or not the convenience of certain tools is worth it in their minds. Because that's what all of our privacy education is really about, equipping folks with the knowledge they need to make their own decisions about privacy. So I've laid out some examples of these conveniences on the slide. The ability to easily order discounted prescriptions, apps that might track your walks, runs, and workouts so you can monitor your progress, maybe insurance-specific apps that allow you to use your phone for telehealth visits, maps or GPS software that store your common travel patterns, advertising customized to your interests, single sign-on to multiple websites. For example, linking something to a Google account, lots of things you can sign up for through Google. So Fitbit, I think Garmin, those tools that are owned by Google, you can often use that as a one-time sign-on. And then the ability to sign on to devices or access locations with biometrics like fingerprints, face recognition. So all of these things make our lives more convenient. But by the same token, there are a lot of risks involved with all of these. So one of the things we talk about a lot is that balance between risk and convenience. I wanted to give you some examples of what PII and PHI are. Some PII, so personally identifiable information, might include your mother's maiden name, driver's license, credit card information, biometric information. So again, fingerprint, facial recognition, social security, date or place of birth, really any information that would make your personal identity easily traceable. One thing about PII is that if we have one of these pieces of information, we might not be able to identify an individual specifically. But if we have a few, it becomes easier and easier to identify someone specifically. And then in the center here, protected health information, so PHI, and that might include patient names, geographical elements like addresses, cities, counties, zip codes, admission dates, discharge dates, telephone numbers, email addresses, medical record numbers, account numbers. And then any other data here on the right that might be vulnerable during a health data journey could be your location, passwords, clicks or views. When we talk about advertising, again, images and other personal information. I talked briefly about this web map from the data map last time. I really encourage you to check it out yourself at www.thedatamap.org. At this time, I wanted to show you some other aspects of this site. For $50, the folks behind this tool purchased a publicly available data set from Washington State, and that contained virtually all the hospitalizations occurring in the state in that year, which included patient demographics, diagnoses, procedures, attending physician, hospital, a summary of charges, how the bill was paid. It did not include patient names or addresses, only zip codes. So that was the level of personal information that included in those records. And this is what their team had to say about this experiment that they did. Do you think your family, friends, an employer, or bank could find you in that data? These people would know facts about hospital visits belonging to you. As a proxy for the information they would know, we used a sample of newspaper stories that reported on public incidents, such as car accidents and fires. And those short reports often included a patient's name and residential information and explained why the person was hospitalized, such as a vehicle accident or assault. A simple analysis uniquely and exactly matched medical records in the state database for 35 of the 81 sampled news stories found in 2011, thereby putting names to patient records. As a result of that work on Health Data Map, Washington State changed its way of sharing these data to create 3 levels of access to all the fields provided prior to this experiment. They're now limited to applicants who qualify through a review process. So in other words, they took some PII that was publicly available, as well as some PHI that was stored in a data set. And they got that data and were able to connect that data to an individual. And as you can hear, that resulted in actual change in policy and procedure. So a testament to on one hand, how risky it can be to have our information out there. On the other hand, that change is possible, that if we advocate for our own privacy and utilize tools like this, change can be made. This is another fascinating part of this website, and it's the mobile data health page. And here you can see a chart that reveals what companies or domains receive sensitive information from Android apps. A lot of these are health apps like Map My Walk, Nike Running, GoodRx, Fitbit, drugs.com, and others. I know it's really hard to see on the left and right here, but in just a second, we're going to do an activity with this so you can take a closer look by yourself. But this can be a really interesting tool for personal use, but it's a really great resource when you're teaching privacy. So in your space, if you're teaching privacy to the public, or if you're thinking about health privacy workshops for your own community, this can give folks a really good idea of what is shared and what's at risk. So I'd like to ask you to do a short activity, one of a couple that we'll do today. So I want you to go to this website, https://thedatamap.org. And then once you get there, scroll down until you see the mobile data chart. And then use the drop-down menu to find any apps that you're familiar with, or maybe that you use, or any that you're curious about. And I want you to just quickly investigate what information is shared and with whom is that information shared, with what domains. And then maybe in the chat, share why that's a concern. What did you find when you investigated this? So I've given you some information so far, a ton of information about data privacy, our health data that might be at risk, but a lot of this can be a little bit overwhelming, and we recognize that at Library Freedom Project. So I wanted to, at this point, pivot and think about where we come in as library workers, how we can help our communities understand and mitigate the risks involved with sharing health data. One thing we can do is ensure folks are getting the most reliable information possible. We can't make personal privacy decisions for our community members, but we can equip them with information, critical eye, and trustworthy resources. So these are reliable resources, the National Library of Medicine and the network of the National Library of Medicine. I won't go through this whole chart today, but there are 7 different regions of the network of the National Library of Medicine, and that's their outreach arm. The NLM's our outreach arm. They have a ton of resources, and they are there to help. So any health resources you might need, you can reach out to your regional representative, and you can also just go to the NLM website or NLM's website. But this is a really great resource for all kinds of health information related to privacy, but just generally combating misinformation and disinformation. All of these sites, NLM, NIH, NLM, they are not, they don't have any ads on them, which is a really great clue that they are reliable resources, and they think really carefully about what they lead you to as well. So NLM specifically, their mission is to provide equal access to biomedical information to health professionals as well as the public, so that they can make informed decisions about their health. And they do this through resources on their website, funding projects. So be sure, if you are library staff and are eligible to apply for grants, NLM has some really great grants available. And that could include some health privacy workshops, certainly. So if you're interested in bringing some of this information to your space, NLM can help you do that and can help investigate those privacy issues, address health concerns at your library. If your institution is not a member of that network, I'd really recommend joining. It's free. And once you sign up, you'll start receiving weekly postings about resources, trainings, funding, and a whole lot more. So a really rich resource that we want to make sure to point our patrons to. There are a few resources that I'd like to point out from NLM and NLM. PubMed, it's a great resource, free authoritative database of citations to articles in the field. So if you are interested in looking up any articles that a certain professional has written on a health topic, that's a great place to start. If you're looking for information about a certain disease, that is a great place to start. The NCCIH, which stands for the National Center for Complementary and Integrative Health, and that's there in the middle. It's the lead government agency for scientific research on the diverse medical and healthcare systems, practices, and products that aren't generally considered part of conventional medicine. So this is a really great tool to see what's promising, what helps, and why, what doesn't work, and what's safe when it comes to alternative medicines and practices. It's a handy tool for yourself. It's a really handy tool to send to your patrons. Because from my own days at the reference desk, we got a lot of questions about new and emerging health trends, about alternative medicines and treatments. So this is a great place to point people to, because not only do we know that it's a trustworthy resource, it also acknowledges the validity of some of those alternative treatments, but it also gauges harm and benefit through a scientific lens. So we can feel comfortable pointing people towards this resource. And of course, everyone's favorite NLM resource, Medline Plus. So this is a great resource for any kind of health question that you might have. One part of it I really liked pointing people to is the videos and tools tab that has quizzes, games, calculators. It also has a medical encyclopedia. And I think having a medical glossary at your disposal is a really handy tool for yourself as a reference professional, but also to give to your community. And we'll talk about that in a little bit too. Another kind of medical glossary that you can use and show people. Also, on Medline Plus, topics are available in Spanish as well as a ton of other languages. So a really great resource for a diverse community. Another resource I wanted to point you to was the Health and Privacy webinar series from Library Freedom Project. So this was actually an NLM funded project in partnership with Cherry Hill Library and the Chinese American Librarians Association. So that was a 5-part series on health misinformation, the nuances of contact tracing, the latest in telehealth. It was a really awesome resource. We invited experts to come and talk about their experience with health and privacy in a digital world. So this was sort of these are the objectives of our project, to improve your ability to read, understand, and explain, to provide a broad overview of health privacy issues, explain how those issues impact different populations, and to provide concrete actions for minimizing threats and to offer shareable resources. So if you want to go to that website, they're all available. It's also a really great supplement if you are conducting a workshop about health data or health privacy in your space. You can use one of these resource videos to kind of supplement that as well. And then finally, the conference summary from our health and privacy series is available in a PDF form as a privacy guide. So it's a comprehensive list of resources, and it includes a really handy glossary of commonly used medical terminology. So I'd really encourage you to check that out. It also includes basic information about HIPAA and ADA. So another great foundational text if you need some support as you present workshops in your space or as you talk to your community about these issues. It also includes a guide to evaluating health resources and information. And it will be translated into Spanish, Korean, Arabic, Chinese, Filipino, and Vietnamese. And that's thanks to the partnership with the Chinese American Librarians Association. So this is a great resource to point folks towards, to print off and have available for patrons, or even just print out and leave copies of in your telehealth booth or health information station. We'll talk about those sorts of resources in just a little while as well. So I wanted to go into more detail about some of the really awesome resources that some educational resources that I like to point folks towards when it comes to privacy. I mentioned some of them last week. Like I said, I'm going to dive a little deeper this week so we can get a better idea of how we can use them in our space. These are great for your own curiosity. I really want you to be able to take these and use them in your own spaces. So first up is the Electronic Frontier Foundation's Surveillance Self-Defense. So EFF is an independent nonprofit. They work to protect online privacy, and they've been doing that for almost 30 years. One awesome resource that they have is this Surveillance Self-Defense, which is an expert guide to protecting you and your friends from online spying. You can read the basics to find out how online surveillance works, or you can dive into their tool guides for instructions on installing the best, most secure applications through their vetting process. And they also have more detailed information in their further learning section. So if you're curious about outside resources, want to learn more about anything, they also have that available for you. Another great thing they have is their security scenarios, and that includes best practices for specific populations with specific needs. They have one for LGBTQ youth that's particularly useful. That guide teaches young users how to explore resources online in a safer way to help avoid accidentally outing peers, family, or online advertisers as a result of online tracking. So this is a great intersection of data privacy and health data privacy. This is a really wonderful resource. And I love that they include a youth-focused section of their surveillance kit. This is a great example of what they offer. This is just a playlist of tips and guiding instructions for creating a foundation for your own personal security plan. And that includes tools to assess your own threat model, to create strong passwords, designing a security plan that works for you. I love sharing this resource because it embodies what we really believe in at Library Freedom Project in meeting people where they are and providing small but solid steps towards privacy. So if you want to check this out, this is just one example of their really rich bank of resources. This is one of my favorites, Tactical Tech's Data Detox Kit. So they describe this as everyday steps you can take to control your digital privacy. They have awesome toolkits and guides available, ranging from beginners to folks who just want to do their own personal privacy audit. Super rich resource. Tactical Tech is also the organization behind a tool called Me and My Shadow. And that gives you a foundation for exploring your own data footprint. And I also highly recommend that tool. So just an example of the wealth of really beautifully designed and informative resources that they have, including ways to control your mobile footprint and scales to use when assessing how secure your accounts are and more. So on the right, you can see they have a really great breakdown of what kind of risk you are taking when you use various accounts on your mobile device. They also have a great toolkit specifically designed for youth. So this is a printable, really well-designed guide that provides teens with a great foundation of knowledge and simple steps to take that can increase their online privacy. I love this guide. For teens, also for adults, like I said, it's beautifully designed and really approachable. So if you want to use this in your workshops, if you want to print out and have copies available in your teen space, or again, if you have a space for folks to take telehealth visits, this is a great resource to print out and have available. The Safe Data, Safe Families Project knows that libraries provide an important outlet for many families who are trying to submit intake forms, pay bills, and a lot of other sensitive processes. And they work to address those challenges. So they spent 4 years talking to library staff and families about these challenges, and they've developed a lot of resources for libraries and families alike to simplify and explain some of those big online risks and how to avoid them. So they offer resources for libraries, trainings, policy framework, privacy teaching moments, and programming resources. And they also provide resources for families. So privacy tips, games, activities to help ensure that online information is protected. This is one of those resources. It's a game called Password Mania, and that's designed for both children and adults. It teaches players about the importance of strong, unique passwords through a fun card game. So again, if you want to present anything like a privacy workshop, having some really fun activities sprinkled in is a really great way to talk about these big, sometimes overwhelming issues in a really approachable, fun, interactive way. And of course, Library Freedom Project. So this is a resource for privacy tools. Aside from our online and in-person trainings, we have a lot of free flyers, zines, other stuff that has been created for the express purpose of sharing with libraries and having libraries print out and distribute those. They're all free, easily printable. I wanted to talk about one resource in particular that we have that relates to what we're going to talk about in a moment, and that's the privacy policy template. We'll talk more about privacy policies towards the end of today's workshop, but this is a really good place to start if you want to conduct a privacy policy audit in your library. They give you language to use, some questions to think about, and then just generally a great example for how to build a privacy policy and to tailor it to what exactly you want to say with it and how you want to protect your public. One more thing, so this is the Library Telehealth Guide. It was written by Craig Settles. After he had a stroke, he intimately understood the important role that telehealth can play in a health journey. So this is a really helpful guide as you consider implementing telehealth services in your space, which we're going to talk about in just one second. So this shows you how to identify patron healthcare needs, how to apply for grants and market your funding opportunities, and then how to pilot telehealth services in your community. So now I'd like to turn to some examples that we can look to when it comes to supporting our communities in their health journeys. We can use these as starting points for how we might provide private spaces for telehealth visits, and how we can provide resources for our communities. So Delaware Libraries announced the launch of telehealth kiosk and device loaning initiative at the Seaford District Library in 2021. So in this pilot, kiosks were set up at a few branches to increase access to health and social services for patrons. So the kiosks were designed to provide a solution for people who need privacy and high-speed internet access for telehealth visits, as well as for job interviews, legal appointments, anything else that could include sensitive information. The device loaning initiative, it featured hundreds of Chromebooks and Wi-Fi hotspots at public libraries throughout the state, and those were loaned for a week at a time. So if someone needed to use those at home for telehealth visits, that was available for them as well. Another key piece of this was how they handled the issues of space, privacy, staff training, hardware and software resources, data security, and HIPAA. So any one of those can be pretty overwhelming if you are trying to implement telehealth in your space. But Nick Martin, the emerging technology consultant at the Delaware Division of Libraries, explained the approach that they took. He said, for libraries that don't have the space to handle a standalone telehealth kiosk, they retrofitted their study rooms. And that actually lowered the barrier for entry for interested libraries because it was less capital intensive and space intensive. So more libraries were able to take on this duty for their community when they decided to start taking over an old space that wasn't being used as much and turn it into a private telehealth space. So to ensure privacy and an appropriate telehealth space, he said, we optimize for wall color, lighting, soundproofing, and internet connection. They are hiring new staff to act as navigators. So that is one thing. It might cost extra money to hire these new folks. On the other hand, you could train your staff in privacy and have that become a priority as well. So you can kind of adapt this programming to fit your budget and your space, as well as your staff capability as well. And then all the telehealth participating libraries received a telehealth 101 training so that they were aware of the services that were being introduced, as well as any privacy concerns. I wanted to talk about the Pottsboro Area Library as well, located in Texas. So they were early pioneers of telehealth in libraries, and they developed an active partnership with the University of North Texas Health Science Center at Fort Worth to manage chronic conditions and support health screenings. So these are a couple of the brochures that they handed out for folks, one-pagers about those services. They also have a private space that they offered for counseling appointments. So another example to look to. And then finally, NJ Health Connect at your library. So this was out of New Jersey State Library. It's a relatively recent initiative. It aims to provide health equity by disseminating iPads to interested partner libraries throughout the state that will be used for telemedicine and to provide access to multilingual health information that promotes health literacy and patient empowerment. So this program was administered by the New Jersey State Library and implemented in East Brunswick Public Library. So it addresses inequities through a combination of technology that offers links to telemedicine appointments for doctor appointments, links to COVID, literacy resources, and it also featured a team of certified consumer health librarians. They have a really handy YouTube video, and it's if you just search for that, it gives some insight into their program, and it offers advice for other libraries who want to offer similar services. These examples, New Jersey, Pottsboro, Delaware, they're awesome places to start. So combined with privacy workshops, these types of models could be a really awesome resource for your communities. If you want to and can implement some of these telehealth visits, any equipment lending, training for your staff. Finally, one important thing that we can do is take a look at our own privacy policies and how patron privacy is or is not prioritized in those procedures. So as we examine our policies and our procedures, it's important to understand any potential privacy risks that exist in our space for library users. One example that was fairly prevalent in early 2020 was libraries asking users to complete health screenings in an attempt to prevent the spread of COVID-19. So Becky Use covered this specific health privacy concern in her article called "When Libraries Become Medical Screeners, User Health Data and Library Privacy," and that was from 2020. And in that article, she says, while health screenings are used in other areas, such as employees returning to work, its use in a library to determine which users can access the building brings up questions regarding user health data and what libraries need to think about when going down this path. So she makes some really good points in this. She goes on to make recommendations for library staff that we should keep in mind as we consider the data journey of health information in our library. And whether that's from a specific instance like health screenings, or more broadly when we think about any patron who is seeking health information in the library. And so these considerations are collection, thinking about what user data is being collected on the screener form or in any kind of interaction that we have. This could also be considered from the point of view of what users might be looking up. So what information they might be seeking on your computers, on your devices. Finally, storage. Where are you storing the screener forms? So at the end of that journey, where does all that information end up? So if you have screener forms, where do those end up? Are they entered into a system? And then from the perspective of someone seeking health information, do your computers automatically erase any search history? How are stations set up to clear their history, to make sure that no data is retained between patron visits? Next is access. So who has access to that data in your library? And then reporting. What are your state and local regulations surrounding law enforcement requests for library user data? That is something Library Freedom Project thinks about a lot. We have a lot of information about those kinds of specific questions when it comes to privacy policies. And then retention and deletion. So how long are you keeping forms that could contain sensitive information? How are you disposing of paper forms if you are taking in paper library card applications? What kind of information is collected on those and how are they being disposed of? Another consideration on top of what we already covered is the liability of a data breach if information includes library user health data. So how will your library communicate that kind of breach to its users that could have included health data? How would your library prepare for that? And what would the fallout be for that as well? So thinking about how we communicate these things to patrons, if they understand the risks that are involved. All right, and then revising those policies. So some guiding questions as you think about doing a privacy policy audit in your library. How many years has it been since your library reviewed your privacy policy? What technology does it cover? That changes all the time in a library. So maybe it covers the desktop computers you have, but the laptops weren't around the last time your privacy policy was reviewed. So we want to make sure that all our technology is covered. What materials does your privacy policy cover? What services does it address? Is it inclusive? We want to ask about how inclusive our privacy policy is as well. Is it accessible? Is it written in a straightforward way? Is it easy to understand for people? And does it use inclusive language? I think we can always be vigilant about how things are written in our libraries when it comes to policy and procedure, and if we are unintentionally excluding folks from those policies because of our language that we're using. We like to think about policies this way. Your library privacy policies and procedures are only as effective as the person with the least amount of knowledge and experience with them. In other words, if everyone can't understand them, then no one benefits. So we need to make sure that our policies are straightforward, easy to understand. Some other best practices when it comes to privacy policies include creating interactive scenario-based trainings for staff, because that provides context needed to understand and implement policy and procedure. So those could be scenarios that you present to your staff at meetings. Maybe they're inspired by real events or situations faced by your staff or others. I'm sure that even in this room today, we could come up with some examples of maybe risky privacy situations that came up in our libraries. We could use those as learning opportunities when we talk to our staff about privacy in the library. Another best practice is providing opportunities for staff to discuss privacy-related issues in training sessions, as well as maybe an asynchronous discussion board. So if you use Slack in your library, or if you have some kind of chat ability, and inviting folks to talk about privacy questions, privacy issues, sharing important articles they come across. It might be worth scheduling time into regularly occurring meetings to talk about privacy issues that have come up or that staff might be wondering about. It's also a great way to learn about the privacy concerns that all of our staff face. We might not know, for example, what the front desk folks are dealing with if we're in the children's section. Or we might not know what the security team is dealing with if we are in the back office. So thinking about the wide spectrum of privacy issues that we might have at a library, bringing those up at group meetings is a great way to address them. Finally, have a regular training schedule for new staff as well as refresher trainings for existing staff, and then have those training materials readily accessible to staff through either an intranet or a knowledge base. Because the last thing you want is for a situation to arise without people knowing where to find what they need. So you want to make sure you have regular privacy trainings and that those materials are regularly updated. Because technology shifts all the time. New things come into the library. I mean, I don't have to tell anyone here, but we live in a really rapidly changing world when it comes to health concerns and health privacy concerns. So we recommend performing routine privacy policy audits. And then these are just some basic questions to ask when you do those audits. When was it last reviewed? Who are the stakeholders impacted? And what considerations are made for staff and for patrons? And then I wanted to provide you with this activity as something to take away from this workshop, something to do with your staff or with other library communities you might be a part of. You can also do it today. We have a little bit of time, but if you want to use that asking questions, that's great as well. Locating your library's privacy policy and answering the following questions about it. So was it easy to find? Is it written in straightforward language? How long is it? Is health data specifically mentioned? And then given our discussion today and in the last workshop, does anything stand out to you? What would you add or change in your privacy policy? And at the end of that exercise, you'll walk away with either some renewed proficiency in your own policy, so you'll be able to more fully understand the privacy policy that you uphold in your library, or some actionable ways to suggest improvement to your privacy policy. So if you remember nothing else from these two workshops, here are some quick takeaways. Stay optimistic. Remember that we're working toward the possibility of change. We can make progress and change is feasible. I don't want you to leave this workshop feeling defeated and like online privacy is this big, scary notion. Hopefully you're leaving with some practical resources and steps to take. And then, because one of the best ways to talk about and teach privacy is to use practical examples and provide practical plans to people, I hope you can use this as sort of a lens to think about how your library approaches privacy. And also remember that this is a learning process and we might need to take small steps. We should meet people where they are, work towards the goal of empowering them to understand and make changes that make sense to them. So as we meet our communities and teach these things, remember that everyone brings something to the table and that our assumptions might be challenged, and ultimately staying humble and nimble is a great way to teach and learn, especially when it comes to privacy. That is all I have today. Thank you so much. This is my information. Again, feel free to reach out to me with any questions.